And now, okay, we have, according to the program, a sponsored lecture by Valentis. Sorry, I don't, okay.
Hello to everyone. I will have the opportunity to present you the sponsored lecture from Valentis, and I will talk about the exotic usage of NatAspinH in the endovascular therapy, and more detailed in patients with high bleeding risk. Firstly, what is NatAspin? So NatAspin is a dietary supplement that has two main ingredients. One is nattokinase, the other one is hydroxytyrosol. Basically, an enzyme is the nattokinase that is extracted from natto, which is a traditional Japanese food from soybeans that are fermented. And the other one, hydroxytyrosol, is derived from olives and is a potent antioxidant. Together, these components aim to promote healthy blood flow and overall cardiovascular wellness. How is the nattokinase working? Basically, anti-atherosclerotic, lipid-lowering effects, pleiotropic effects that are basically leading to neuroprotective actions and antiplatelet and some anticoagulant effects. How is this working? The nattokinase is directly connected with the fibrin degradation and activating the plasmin and then the plasmin again, which is making this basically antithrombotic effects of the ingredient. As I told you, it degrades the fibrin directly, which is believed to increase the release of 10-hectaplase and subsequently increasing the formation of plasmin and leading to this a blocking of thromboxane formation and resulting in inhibition of platelet aggregation and without producing excessive bleeding, as we can see in other antiplatelets drugs. Our center experience is very broad, with a lot of patients that we have started on this medical therapy for the last 5-6 years. The main reason for that is the antithrombotic effect with reducing the bleeding. Several interesting exotic case reports. The first one is 78-year-old male patient with decompensated heart failure, basically a severe aortic stenosis with ischemic heart disease and permanent atrial fibrillation. As you can see, the concomitant morbidity with dyslipidemia, diabetes, and arterial hypertension. Basically, a patient that is normal for our clinic. You can see the echo, severe aortic stenosis, keeping in mind his advanced stage and polymorbidity. We decided that the best treatment for this patient is implantation of a TAVI. Upon admission, the patient is taking only P2Y12 inhibitor without any anticoagulant because a history of capillary toxicity when taking anticoagulant. So basically, you can see the TAVI procedure, minimalistic approach that is normal for our center, with a very good result, with the hospitalization of the patient on the second postoperative day. Keeping in mind the capillary toxicity, we decided on giving the patient Syntrom combined with NatAspin, and followed up the patient, had no complications and his swab results were normal. The other case report is a 73-year-old male patient with numbness and weakness in the right hand. The patient is known to have undergone implantation of a stent grafts into the aorta, the iliac arteries, because of infrarenal aneurysm. He also has ischemic heart disease, which was treated endovascularly, and in the moment taking only P2Y12 inhibitor. Basically, a patient was diagnosed with severe stenosis of his left internal carotid artery, which we did endovascular retreatment with stent implantation. Because a history of severe gastric bleeding and embolization procedure due to endo leak, the patient was deemed at high bleeding risk, and we discharged him only on basically a single antiplatelet therapy on top with NatAspin. There was no bleeding and no ischemic events with intact stents on the coronary and carotids in his follow-up. Study that we have just started in our hospital with nattokinase. We collect patients who has a stable angina and are stented with drug-eluting stents, which are the last one of the most modern drug-eluting stents, and we give them the first month dual antiplatelet therapy with clopidogrel and aspirin, and after that we divide them on two groups, and the one group is staying on the same treatment, the other group is starting taking clopidogrel with NatAspin. Basically, the current guidelines are saying that despite stenting of the coronary arteries in stable angina, we should give them dual antiplatelet therapy for 6 months. Of course, the high bleeding risk patients, we can have the escalation of the therapy on the 3rd month, but there is not so many trials and data about giving only 1 month of dual antiplatelet therapy despite the bleeding risk. So that is what we have started, and basically we want to see if clopidogrel and NatAspin together after the 1st month after stenting a patient with stable angina could protect from stent thrombosis and have the patient to have lower bleeding risk. Thank you.
Any questions?
That is a very good question. It's not included in the study, so it is not mandatory to test them. But yeah, our team talked about that, and I think we will test all of them.
And do you have experience with the other P2Y12 inhibitors and NatAspin?
Yes, we have patients with the other drugs, but there is a different story because we mainly give them for acute coronary syndrome, and there you cannot de-escalate so early the therapy. Despite of that, let's say after the 12th month, you can remove one of the antiplatelets and maybe give the patient NatAspin and see what is happening. With that, you will be basically more secure about the ischemic risk, and I'm not sure about lowering the
problem is that you don't have a patient having only clopidogrel without anything
Yes.
added. So you have something like early de-escalation treatment, and I'm not sure whether NatAspin is adding something on the efficacy side. For sure, it is on the safe side with the bleeding. So I don't know how we would interpret the results, but once you have it,
Yes, we will
can
see.
discuss it. Okay, thank you so much.
Thank you.